The talk was really looking at the two main causes of variability and severity in sickle cell disease, and why it's important. It's important really because sickle cell is very, very variable, and some people have very few problems, whereas others have quite severe progressive problems. And understanding that variability might help identify ways of changing it, so that you identify ways in which the more severely affected people are different, suggest different treatments and different approaches. And obviously the two main sources of variability are genetic and environmental, and the genetic side's been studied quite intensively and with a lot of big studies, and relatively little good information has come out of it, other than the co-inheriting alpha thalassemia significantly reduces the severity of many complications of sickle cell disease, and also inheriting determinants, which increase your hemoglobin F level, again, protect to a large extent against many complications, although not against all of them. And that second thing has been the genetic factors underlying that have been used to develop new treatments with gene therapy in particular to knock down BCL11A to boost hemoglobin F levels, which is one of the interesting areas of development going on in sickle cell disease. And the second very big area of variability is environmental, which is less well studied and kind of obvious in a way, but not very well understood. The big advantage of it, the importance of it, is that it is important. It explains a lot of variability, and also it's potentially modifiable in fairly simple ways. So the starkest demonstration of the importance of variability, environmental factors, is the difference in outcomes in say, countries like Europe or continents like Europe, where most children with sickle cell disease, nearly all, more than 95%, survive to adulthood, compared to African countries where the majority die in childhood, and certainly fewer than 50% reach adulthood. And it's genetically identical pretty much, and the differences are clearly all environmental. Some of it is fairly obvious, like access to hospitals and access to treatment and blood transfusions and things like that, and the prevalence of malaria. But there are other more subtle factors, like people are being aware of the effects of cold weather or an environmental factor, exposure to cold or rain or wind, and how those affect individuals, causing symptoms. And if we can understand those better, then giving fairly simple advice, like what to do when it's windy, would be potentially have quite a big effect on the outcomes for people with sickle cell disease.